Welcome to 21st Century Health. I'm Jackie Bales. As new healthcare legislation takes effect, providers are given incentives to reduce healthcare costs while achieving better outcomes. And in this new world, telemedicine offers some real advantages. To learn how telemedicine can benefit providers and patients, especially in long-term care, we're joined by Phil McNulty, Chief Financial Officer and Chief Operating Officer of Proconnections. Welcome, Phil.
Thank you, Jackie, and I'm delighted to be here.
What issues in the long-term care industry are really driving the changes in healthcare?
Well, I think critically right now it's the escalating cost of providing health care to long-term care patients. I think its second is the coordination of benefits between the various providers, between the facility, the hospital, as well as the physician. And third, and most importantly, I think, is that having access to specialists. And I think telehealth helps us provide and meet all three of those.
So tell us about Proconnections, Phil, who you are and what you actually are offering in telemedicine to help address this.
Proconnections is a privately owned custom solutions company that specializes in audio-video technology. Started the company about 10 years ago with a focus on manufacturing. However, in our efforts to find new customers and new opportunities, our salespeople found an opportunity in the telehealth industry for a client that provided ICU room monitoring, but needed an audio-video component of their product that met their needs in an affordable fashion. We took the challenge, developed a package. It became the forefront of our products that we now develop for our telehealth industry.
Very interesting. Well, let's see how this telemedicine solution works in the real world in this 21st Century Health Field Report.
The ability to maintain a high level of quality care for patients can be greatly impacted by many factors. Proconnections' telemedicine solution offers solutions to meet the changing demands affecting the medical industry.
Benefits for to the patient is that we're able to access the patient remotely right away. We're able to treat them right from where we happen to be at the time. There's no waiting for a physician to arrive and see the patient. We're able to access these patients through high-definition technology and get a good look at them. We're able to listen to their heart, listen to their lungs, look at them very closely, look at their wounds with the telemedicine camera. We're also able to treat these patients much faster, get them on antibiotics, and figure out what needs to be done much quicker. The patient also won't miss their medications while they're going to the hospital. They feel more comfortable in their own surroundings at the nursing home. The family is also very happy because they're able to see their loved ones regularly and have access to the patient's physician immediately while they're at the nursing home.
The Pro MCS 2000 offers an affordable option for healthcare providers to quickly assess medical issues and provide treatment and gain access to specialists over the internet from anywhere in the world. Improve the quality and consistency of patient care, provide post-acute care on-site, and decrease hospitalization readmissions, and improve regulatory compliance.
Phil, the Affordable Care Act, or ACA, is funneling money to test new models of care delivery. What are the programs that are currently being funded that will affect the long-term care industry?
Well, one of them is through the Affordable Care Act and through Medicare, other insurance providers, and other medical providers, they've formed organizations called ACOs. These accountable care organizations have been charged with identifying a model that identifies how to provide the care to patients, both in long-term care and others, while maintaining an effective cost structure and identifying a benefits plan.
Well, of course, we know that that is such an expensive type of care, so it's obvious why they're trying to focus on that. How do you believe telemedicine is going to transform patient care within the long-term care industry?
Well, I believe telemedicine in and of itself, and we believe it, that provides the easy access and cost-effective access to both the physicians as well as the specialists, as I mentioned before, to provide more effective care. It also provides, and particularly in the long-term care facilities, the after-hours coverage capability that they presently don't have. The biggest challenge right now and the highest increasing cost that long care is facing right now is hospital readmissions. When a patient after hours is coming down with either has a fall or has some reaction to some medications, Generally, the practitioner in the facility is talking to the doctor on the phone, and to be cautious, they're putting the patient in the ambulance and back to the hospital. Telemedicine gives that doctor the tools to better diagnose the situation, make a determination whether to treat or transport that patient within the facility. Again, saving money.
And the person who is helping the patient on the other end, in the patient's room, what kind of qualifications do they need?
Well, generally, they're obviously a medical professional, in a sense, either a nurse practitioner, registered nurse, PA. It could be anybody that within the healthcare facility, the long-term care facility, providing that after-hours coverage of those patients.
And so through the camera, the microphone, the special stethoscope, the doctor is really seeing the patient, even though they're obviously not in the same room.
The doctor's seeing the patient's seeing the doctor. And that's the important part. You get a sense of comfort. You know your doctor is asking you the questions. The doctor has the opportunity of hearing your heart, your abdomen through a stethoscope. So they're getting some real-time information, as if they were there.
What background does your company have in the field of telemedicine itself?
Our largest customer is a client who offers an ICU room monitoring solution. We provide the audio-video technology. Their product provides the medical telemetry, but they're monitoring ICU rooms from a remote core, 100, 200 miles away. It was our introduction, and quite frankly, into the world of telehealth. We took that core technology from an audio-video component and identified opportunities, specifically today within the skilled nursing market, to be able to provide that medical consultation capability from a remote, user-friendly environment for the doctor.
Now, we just saw the ProMCS 2000. What features does a telemedicine solution like that have that would provide the physician with the ability to offer a better level of care to the patient?
The ProMCS 2000 solution is really a twofold solution. Number one, it is the appliance that resides with the patient in the skilled nursing facility, which is a monitor, a camera, a speaker, a microphone, as well as an audio-video server. The other component of the product is a client piece of software called a client viewer. That resides on the doctor's laptop or their desktop computer. Provides them access to that appliance in front of the patient. Gives them control of the camera to be able to zoom in and as well as the volumes to be able to talk to it. The ProMCS also provides secondary audio and video channels. The audio channel is used typically for an electronic stethoscope, where the attending nurse in the facility is, again, utilizing that stethoscope with the patient so the doctor can hear what's going on. Whether it be the abdomen, whether it be the heart, whether it be the lungs. The video channel provides a video otoscope. Check your eyes, your throat, your nose. Again, having all that information available just as if that patient was in front of them.
Amazing. How would this healthcare model impact a patient's level of care? Why is this good for the patient?
Well, I think it's twofold. Number one, it gives them a level of comfort knowing they can see their doctor instead of getting a transmission of a communication from a nurse over the phone. Second is access to specialists in the case need be. A specialist can log in and be able to evaluate that patient as well for a particular situation or a particular reaction. And third, it's overall comfort and security.
So it's just so much easier. They don't have to get up and be transported somewhere.
Correct.
What about the patient's family? How would they benefit?
Well, I think from a patient's family point of view, you get a level of comfort yourself that you know your loved one is being taken care of with the best technology available, and they're not putting through the trauma of back and forth to the hospital or what have you, that they're getting real-time care.
What are the benefits to the physician to use a telemedicine solution when treating critically ill patients?
Well, I think clearly that number one gives them the convenience of being able to see their patient anytime. Without having to travel or without having the patient to travel to see them. It provides them easy access for follow-up with their patient based on their treatment plans and how are they reacting. And overall, it's just checking in on their patient.
And the healthcare facility or the healthcare organization itself, what are the benefits for them?
Well, today, in particular with the long-term care facility, generally the patient, they're receiving revenues from the insurance provider, whether it be Medicare or insurance company, and a X payment. When those patients are transported to the hospital, that revenue stream moves from the facility to the hospital. Quite frankly, generally the average is 5 to 8 days that bed is usually vacant.
Oh, they have to keep that bed available for their patient to come back to the long-term.
Or quite frankly, another patient coming in to go in there. So the average that we've identified is about $500 a day that bed is worth from a revenue stream to that facility. So if it's 5 to 8 days, it's substantial money, $2,500 to $4,000 worth of revenue that they're missing the opportunity on. Second is it effectively improves their overall cost to deliver service. Leveraging the doctors to be able to monitor from their home instead of paying high price of getting them either on site or to travel to get to see the patient. They can see many more patients through the process, so it's a much more cost-effective delivery of medical coverage.
Phil, in what other areas of telehealth are you also making inroads?
Well, I think there are certainly several other areas that are including our prison systems. Providing health care coverage to our prisoners in our correctional facilities is a very costly exercise. Utilizing the technology and telehealth to be able to treat, diagnose prisoners and keep them within the facilities rather than transporting them to a hospital with armed guards and so on and so forth is a very efficient way.
Right.
I think next is telepsychiatry. Where you don't need the peripheral equipment, the stethoscope and the otoscope, but just a medical teleconferencing system, allowing you to talk with a patient remotely and help them through their difficult times. So those are two other areas we've been focusing on today because we believe there are real benefits today. The entire medical industry is wide open for the future as things change and as laws change.
Wow. You know, I've heard of telepsychiatry with the telephone, and that is very beneficial. But you can see where it would even be more helpful to be able to see the patient, see what condition they're in.
Absolutely.
So in your opinion, Phil, what does the future look like for organizations that embrace telemedicine in long-term care facilities versus those that do not?
I think you've got to look at long-term care facilities today as a business. And quite frankly, if that business isn't taking all of the advantage of technology to improve the delivery of services to their customer, increase their revenue stream, manage their costs, and basically provide a competitive advantage, they're going to miss the boat.
Well, Phil, you've made some really good points about the value of telemedicine, both to patients and the providers. Thank you for sharing the details with us.
Thank you very much, Jackie.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.